I've actually been with Ortho Montana for 3 years like the rest of us. Our merged entity formed about 3.5 years ago, but the origins of this practice came from 2 pre-existing strong practices before: orthopedic surgeons and Montana Orthopedics and Sports Medicine. And I was with the former of those groups and started there in 1993. So it's been 18 years I've been here. Well, when I came, it was the partners, really, and the fact that my wife liked it. My partners were trained at Yale, Harvard, and Stanford, and I knew Jim Elliott was coming, and I liked Jim. I liked his personal skills, and quite frankly, you know, the synergy of opportunity where there wasn't much of a provider base, particularly for people that did adult and pediatric spine in this state, and the opportunity to work with fine colleagues was what initially intrigued me, but thereafter it was really the fact that my wife felt we'd be better centered, better balanced, have a proper life-work balance here, and she was, you know, correct about that. Well, I love taking care of children. They're innocent, they're completely not responsible for most things that happen to them, you know, in every way, and they need tender, loving care and someone to take care of their health needs and every other need that might arise until they're obviously mature and on their own. So it's a special privilege and pleasure, really, to deal with those families, and you know, you're dealing with the entirety of the family and the special needs of this child. And children get well easily. They're pleasant, most of them, almost always, to deal with, and you know, I love taking care of them. They're just cute. You know, you look in their faces, and just like any little child that's a friend of the family's or your own child, it's, you know, pretty endearing. And they get engaged really easily. There's great eye contact. They follow you around and want to know what you're up to, and it's fun to joke around with them and just have a little bit of fun, you know, while at the same time you're really dealing with the realities of what they have and figuring out a plan. You just come to work and meet a patient and their family that have an issue, and it's sometimes through no fault of their own as well that they've come to find themselves in a situation where they need some help. So all we do is we try to deal with the realities that people bring to us and do it as compassionately as we can and as well as we can, and try to maintain a sense of optimism and hopefulness, because there's, you know, a great deal of ability to deal with some of these things. I like the spinal deformity side of things. I've gotten more interested in it as the years have gone on. I did a fellowship in that in New York City at Cornell. And so when I came here, one of the reasons I really wanted to come here to Montana was I knew I could do both the children and the adult side of things when it came to spine. I think increasingly as the population ages, we're dealing with more adult deformities. And we're dealing with more fractures that are insufficiency fractures associated with osteoporosis, because our, you know, population's getting older. The older demographic is a larger percentage of the overall population. So just like with hips and knees, when you're seeing more arthritis problems, you're seeing more of these age-related conditions of the spine. And they also include spinal stenosis, the acquired narrowing of the spinal canal. Every day when you go home, after typically, frankly, 12, 14 hours is not unusual for the average provider around here. You'll be able to think of 5 or 10 or 15 reasons that day that was really a meaningful day, that you did something that was different. And usually, for instance, in the clinic, it's when someone comes in and they're very, you know, obviously appreciative of the fact that they're more functional, they're able to enjoy their life more, they're more comfortable, they're not requiring, you know, the medications that were covering things up. Basically, they have a problem solved. And that, especially when it's a child, you know, it's particularly meaningful, but it's meaningful on all levels, quite honestly. If you have a passion for something and you work hard at it, you'll probably get to where you need to be if you just stick with it. But you have to work hard at it and, you know, work at it every day. And over the course of many years, obviously in medicine, you're going to stay the course in order to achieve your goals. But I knew the very moment that I started doing it that I would like it, and for the right reasons. And yeah, I've enjoyed coming to work every day.